So after you've done the head portion of the physical aspect, you also need to do the orientation aspect. So when you walk into your patient's room, you're wanting to look at them. As soon as you walk in, you're cleaning your hands, you're explaining who you are, you're explaining why you're there, you're observing the patient. Are they waking up as you're talking to them? Are they responding to you? Do they appear to be in any kind of distress? Are they uncomfortable? Are they grimacing? Do they have tears in their eyes? Like, what is their overall situation? How do they look for the most part? Sorry, I had to pause for a second to let my dog out. So we're looking just to see their overall physical well-being. Okay, are they breathing okay? Do they appear to be in any kind of distress? Are they sweating? What is their physical appearance? So then you start to talk to them and you explain who you are, what you're there for, and that you're going to ask them a bunch of questions. You start out by verifying their name and date of birth to see are they oriented to themselves? Do they know who they are? You're always going to check allergies too, because you want to make sure that you don't touch them with latex if they have an allergy to latex, if they have a contrast test that they have to do, if they have an allergy to iodine, that would be an issue. And so you want to verify if they have allergies. And then you're going to focus on their orientation. You're going to ask questions like, can you tell me the month? Can you tell me the year? I don't specify the date because I personally struggle to remember what the specific date is. So I just simply ask, what month is it? What year is it? From there, I then ask, do they know where they are? So can you tell me where we are right now? If they aren't able to pull hospital, or if they're not able to pull the name of the nursing home, I might say, well, what kind of facility are we at? Are we at a school? Are we at a nursing home? Are we at a dentist? And if they pick the right one, then I'm going to kind of give them like a partial credit. Like they kind of know what's going on, but they couldn't specifically say the name. That's okay. They still have a good idea. Then I'm going to ask, do they know who the president is, right? Trying to see if they fully understand the time and the situation. And you can ask questions also like, why are you here? What brought you into this facility? To kind of really get an idea of, do they understand their overall situation, right? So they alert and oriented to self, situation, time, and place. We want to make sure of all of that. And then we would grade our patient as oriented to 1 if it's just that they know who they are, oriented to 2 if they know where they are and who they are, but they don't know the date and time or the place, you know. So it just kind of depends. You kind of break it down individually. And you got to keep in mind, when I do my assessment at 8 o'clock at night and the patient has sundowning, their orientation status may vary from when you do it at 8 a.m. when they're more alert and oriented and aware of what's going on. So your assessment is very subjective. What you see and hear is what matters. You don't compare your assessment to somebody else's because it's whatever you see and hear in the moment as you're doing your assessment. But I hope that this helps kind of break down the orientation aspect of the head to toe assessment.